So the fundamental movement pattern is hip hinging. We use it all the time, for a deadlift, a squat, or just fundamental movements, functional tasks like bending over and picking up something off the floor, lifting our bags, if we're falling down to the ground or picking something up, we go into that hip hinge. And what we see in a lot of cases if people with knee, hip, or lower back issues is that movement pattern can often be perturbed. And what we start to see is that back dominant movement comes in instead of being hip centric. Now, it's not by any fault that if you take our spine, either side of the spine, we've got ball and socket joints, right? So our shoulders and our hips, ball and socket joints, they love to move. And so we want to make sure that the movement is coming from them. Again, ball and socket joint designed to move rather than the spine, which is not a ball and socket joint, not meant to move that much, okay? Particularly the lumbar spine. So, for example, we see a lot of people getting into and out of a chair tend to be quite back dominant in their movement. So getting out of the chair, what they'll do is they'll flex their spine, drive their hips, and then extend up from the spine. Now this, if somebody's experiencing back pain, say for a flexion intolerant disc bulge, getting into the position might trigger their pain doing it that way, or someone who's extension intolerant when they extend back up and loading their facet joints. So that's a very back dominant movement. What we want to see is a hip centric or hip dominant movement. So we coach our patients here to shuffle towards the edge of the seat, have our feet planted nicely underneath us, and what you're going to do is hinge from your hips and then drive straight up so our back stays relatively stable. So hinging forward, driving up. As you can see, my back didn't move too much. All the movement came from the hips. Again, ball and socket joints, they're meant to be nice and powerful through movement, and that's why I want to get them moving. So if we want to train this one, we start off with something called the short stop position, as in baseball shortstop, or silly mid-on position for us who play cricket. Basically, I'll show you from front on first. The shortstop position is here, and what we're going to just get down is sliding, hinging the hips, and this is the shortstop position, right? Baseball or silly mid-on, and so this is a great way of teaching those movement mechanics. So if I show you side on, again, we're going to be moving from those hips. Your hands are going to start on your upper thighs, and what you're going to do is initiate the movement with those hips driving backwards, hands sliding down towards our knees, spine stays nice and stable, relatively still, and then to come back up, we do the reverse. We pull those hips through and back up. Again, spine stays relatively stable. So that's a great way to coach that. So again, if you're coming down, brushing your teeth or grabbing something out of the cabinet or something like that, great movement, get it all coming from the hips. Now another version, if you're struggling a little bit with that, is to go onto our knees. So tall kneeling position, and what you want to do is try and drive your hips down towards your feet. So again, hands coming on top of our thighs, and we're going to be driving back down. As you can see, my hips are hinging, my spine's actually staying still, right? Relatively minimal movement coming at the spine there. So I'm driving backwards and then doing the reverse by pulling my hips up and through to get out of that position there. So again, we're training the movement pattern, right, to become more hip centric rather than back dominant, and the hip hinge with the short stop position is a great way to learn this.